Welcome back to our video series where we continue to talk about something we all experience and need to take care of, mental health. For our second video, we will be hearing from Identity. Identity works with young people and their families to provide wraparound services. Let's learn about Identity's program, Encuentros, and other services focused on mental health.
In the heart of Montgomery County, Identity is transforming lives through a powerful blend of connection, culture, and care. At the heart of this work is Encuentros, a program inspired by a simple but profound idea that mental health matters and everyone deserves a space to be seen, heard, and supported.
¿Cómo le vamos a hacer frente a la adversidad?
Perseverancia.
Born out of the need to address gaps in mental health support for Latino youth and families, Encuentros brings healing to the forefront by offering non-clinical, community-based support. Leading this transformative work are Diego Uriburu, Executive Director of Identity, and Program Director Carolyn Camacho. Together, they're championing a new model of mental health support, one rooted in trust, culture, and community.
During COVID, many of our therapists decided to leave and start their own practices. Our population was suffering emotionally, and we met with the community, and they shared that in many of their home countries, they did not all go to see a therapist when they had to deal with social emotional issues, anxiety, depression, that they turned to trusted individuals, for support. And that basically started this. The community had an idea that needed to be tested. We tested it out, and the results were amazing.
Unas tremendas esculturas.
The word Encuentros means like a coming together. So as Diego said, this was a program that we designed with the community, for the community, and we're implementing it together with the community. And I think that's been the secret to its success.
Since 2021, Encuentros has served more than 4,000 adults and 2,000 youth. Unlike traditional mental health services, it meets people where they are, emotionally and culturally. It focuses on storytelling, group dialogue, and community building to create a supportive environment that feels familiar and safe.
The individuals that participate find a support network that lasts beyond Encuentros, the 9 sessions or 11 sessions. The other thing that is extremely important is that our communities have always been on the side of being recipients of services. They went from being recipients to being providers. They are the ones who have the solution. They are the ones running the sessions. They are the ones recruiting. So suddenly the power shifted from providers to the community itself.
Diego is grateful for the strong support he received from the county when he first brought the idea of Encuentros forward. An early vote of confidence that helped turn a vision into a vital community resource.
Encuentros could have never happened if not for the county, HHS, particularly the Latino Health Initiative, who we went with the idea, said this is what the community is saying, and they could have said, no, sorry, we're going to speak with Dr. such and such. But they said, yes, let's explore it. It sounds like a great idea that the community is empowered and feel they have a solution. Let's test it out.
At the heart of Encuentros is the power of culture. By honoring language, traditions, and shared experiences, the program helps break through the stigma that can keep so many from seeking support.
That's the beauty of Encuentros, is that folks do not associate it with going to therapy. They are associated more with a support group that is quite structured.
It's the community themselves that have been the ones that have been key to demystifying the mental health, and because they're often recruiting, people are coming to the group because they've been invited by someone they know. I think that's really been the key.
This work is made stronger through collaboration. A vital partnership with the University of Maryland has expanded Encuentros' reach.
It's not easy to measure outcomes for this type of program. We embarked on this rapid cycle evaluation process, and we, from the very beginning, had baseline and exit surveys, and focus groups that we did, that the University of Maryland and their team did with participants, using different scales, validated scales, to measure the impact of Encuentros, and the results were really remarkable, showing the difference in participants who had at baseline had showed significant anxiety, and after participating in the Encuentros group, those levels diminished.
From moments of breakthrough to stories of personal transformation, Encuentros is shifting the narrative around mental health. One story, one gathering, one encuentro at a time.
The parents that want to go from participants to community mental health workers, young people who are thinking now a career in health because of this, particularly mental health, and the ripple effect. Having served 6,000 youth and parents over the past 3.5, 4 years is really impactful. How do you see 6,000 clients one-on-one? At a time where people really need it.
As the program continues to grow, the vision behind Encuentros is just getting started. Diego and his team hope to one day expand its reach.
The dreams of maybe one day this becoming a community-owned national model that could be implemented in many other communities across the nation.
To learn more about Encuentros and the work Identity does, visit their website. In Gaithersburg, I'm Marcia Sahalu.
Thank you to Identity for that message. Make sure to check out their website for more information. As we continue to spotlight different organizations and services in Montgomery County, I want to encourage people to seek out services. It's okay to not be okay, and it's even better to talk about it. Let's make mental health an everyday conversation and approach it as our primary necessary care. Thank you for watching our mental health video series, and see you in the next video.